So I'm going to talk to you about the skeletal anatomy relevant to the sacroiliac joint injection. So sacroiliac joint is the joint between the lateral edge of the sacrum and the ilium. To target this joint, there are two ways to scan this joint. You can start from the ilium, come down, look for the piriformis muscle, move medially, look for sacrum and the ilium, and you can look for the joint by that technique. Another technique that you can use to scan this joint, start to put the probe on the posterior superior iliac spine, where you will see a big hump, posterior superior iliac spine. Keep bringing the probe down. When you actually at the lower end of the posterior superior iliac spine, suddenly that round bump will become completely flat, and then you will only see two bony landmarks, the lateral edge of the sacrum and the ilium, and that will help you identify the sacroiliac joint. And I find this technique is very useful and very easy. Look for the posterior superior iliac spine, bring it down, bring it down, bring it down, and you will only see these two bony landmarks, and that will help you to identify the sacroiliac joint. When you look at the joint that way, try and move the ultrasound medially, and that will help you also identify the S2 foramen, because this is the S1 foramen here. S2 foramen, ST foramen is usually coinciding with the lower edge of the sacroiliac joint, and this is a true sacroiliac joint. Now, how would you target this joint? You can either target it in plane, going from medial to lateral, or you can do an outer plane technique, bringing the needle from outer plane in the middle of the probe, getting into the joint. Now, this joint is very small joint. 2.5 cc of local anesthetic and steroid mixture is good enough. You can inject 2.5 cc inside the joint, try to bring the needle out, and you can also inject the ligament with the rest of the 2.5 cc of local anesthetic and steroid mixture. So just to recap, start either with the technique of putting the probe on the ilium, bring the probe down, look for the break in the line of the ilium, and you're looking at the greater sciatic foramen. In the greater sciatic foramen, you only have one muscle, which is piriformis. Look at the piriformis, move the probe medially, looking for the two bony landmarks, the lateral edge of the sacrum and the ilium, and that's your sacroiliac joint. The other technique would be start from the posterior superior iliac spine, bring the ultrasound probe down. Once the posterior superior iliac spine becomes flatter, it will bring you down to two bony landmarks, same lateral edge of the sacrum and the ilium. You can do an in-plane technique from medial to lateral, getting into the joint, or an outer plane technique in the middle of the probe, getting into the joint. Thank you. So I'm going to show you how to scan for the sacroiliac joint in a systematic manner. First thing I would always do is recommend a palpation of the posterior superior iliac spine and putting your probe on the top of the posterior superior iliac spine. So I'm going to freeze the image, and I'm going to show you the posterior superior iliac spine. So here we have the posterior superior iliac spine, and then you have a gluteus maximus muscle. So once you see the posterior superior iliac spine, it's usually like a big hump, and once you see that, you will then scan downwards and look for the change of the shape of the posterior superior iliac spine, which will help you to locate the sacroiliac joint. So here we have starting point again, posterior superior iliac spine, and you already have an S1 foramen that's been shown in this picture here. This is the S1 foramen, posterior superior iliac spine, and then we will keep scanning caudad, and you will then see another foramen that will be S2, and at that level the posterior superior iliac spine will become completely flat, and you will see two bony landmarks, which will be the lateral edge of the sacrum and the ilium, and that will take you to the sacroiliac joint. So here we have posterior superior iliac spine, keep coming down, S1, keep coming down. Now we have S2, and then here we have the sacroiliac joint being shown in the image here along with the S2. So we have lateral edge of the sacrum, you have an ilium, that's S2. This is your sacroiliac joint. You can perform the injection outer plane, or you can perform the injection in plane, coming from lateral to medial to lateral. So I'll show you again. Start from the posterior superior iliac spine, then move down. When you move down, you'll look for the S1 foramen. Now we're moving down, and then you will see the S2, and then here we have a lateral edge of the sacrum along with the S2 and the ilium and the sacroiliac joint. So that's lateral edge of the sacrum, ilium, S2, outer plane, in plane from medial to lateral, and I'll show you on this subject how we would perform this injection. Option is outer plane technique or in plane technique. Start posterior superior iliac spine, go down and look for the flattening of the posterior superior iliac spine, and here we have two bony landmarks, the lateral edge of the sacrum and the ilium, and you can bring the needle, either you can go from lateral to medial or medial to lateral or outer plane. So these are the three approaches. You can inject 2.5 cc's of local anesthetic and steroid mixture inside the joint, as the joint volume is around 2.5 cc, and the rest you can inject it outside the joint in the sacroiliac ligaments. Thank you.